I asked Dr. Kate Tulenko about this case. She's the CEO of Corvus Health, a global health firm, and we started with a patient's right to privacy versus the public's right to know.
So most societies have had to deal with this tension between an individual's right to privacy versus society's right to protect themselves. And the general global consensus is that all workplaces should treat bodily fluids as though they're infectious and have the proper safeguards so someone's HIV status shouldn't matter.
Are you surprised by what happened there with that case?
Frankly, I was. I mean, China doesn't have as strict rules as Europe and North America. It was quite surprising, but I think perhaps maybe the hospital and CDC were worried about their liability if someone in the workplace contracted HIV, because you have to balance those liabilities.
And talking about patients' rights in China, what measures do you know that China is taking to better ensure the privacy of various patients, regardless of what their condition may be?
Right. Well, this taps into the idea of the new big data platform. And the government is actually going to set up an independent commission which will set in place rules about how this data is used. Because if they set up a cloud-based database that has all the data from someone from birth, to death, the implications of that data, getting out would be quite severe. People not being able to access life insurance, not being able to get a job, perhaps not being able to get married. So that data security is going to be quite important.
We know that China has been undergoing healthcare reform, and that particular goal, 2020 is, I mean, that's coming up pretty fast. And when you think about how many people there are, can they get there, and what are some of the challenges and concerns when it comes to having all this data in one place?
Right. So I think China's trying to use this as a strength. They have 1 billion people. They can leverage this health data to come up with artificial intelligence or new cures, especially since when you think about the fact that most research has been done on European populations. So it'd be great to be able to do health research on Asian populations because they're diseases that are more prevalent. But if you have birth to death data on everyone in the country, it does raise significant issues of privacy and data breach. Just to give an example, this year, in 2019, the HIV positive status of 14,000 people in Singapore was released. It was released by a former employee of the ministry who sort of wanted to get back. And so it shows that even if you have the proper laws in place, how you protect data security is an important issue.
What about the privacy rules in China? Some say because they're not as strong as in other countries, it's allowed China to do better and prosper in artificial intelligence, as you mentioned, and in medical research.
Yeah. That may be the case, that since the laws are more lenient and in some cases are not enforced as much, the researchers have better access to the data. So I think Chinese citizens and leadership need to make a decision on that balance, the balance between access to data and protection of the individual. There's some people that think if data is de-identified of name, date of birth, and address, it's fine to share it and sell it. But there are other people who think that it's never right to share personal data.
Kate Tulenko, thank you so much for joining us.
Thank you.